let's move on to our third story that we are bringing you tonight, and we're putting the spotlight on. Amid a COVID surge, a mask mandate is back again in the national capital. 500 rupees fine will be imposed if found not wearing masks in public spaces. The mandate comes as Delhi continues to report over 2,000 cases. The positivity rate in the national capital is nearing 18%. While India's overall positivity rate is just around 5%. Delhi on Wednesday reported 2,146 new cases and 8 COVID-related fatalities, highest death tally in nearly 180 days. CJI Ramana too has underlined the need to wear masks in court and has pushed for lawyers to wear masks in the top court as well. Let me go across to Mayank, who's joining us for more details here. Mayank, if you can break down the numbers that the national capital has been seeing, and of course, masks have been made compulsory once again, but what are the other measures that are put in place? Because the positivity rate is extremely high.
Well, absolutely right, and this mask mandate comes in the backdrop of national capital reporting more than 1,000 and sometimes even more than 2,000 cases over the last five to 7 days. And remember, this is not something new. If you will remember that the Delhi has been hit severely by the several waves of COVID-19 pandemic in the past as well. So as per the last bulletin published by the national capital region and the government of NCT of Delhi, 2,146 cases reported in Delhi, including 8 deaths. That was the highest reported by any state in the state. So in the country, and that would have raised some sort of alarm bells among the policy members, leading to this mask mandate coming back in the national capital. However, one concerning and one underlying aspect could that be that this surge could be underlined to that the sub-variant of the Omicron variant, the BA 2.75, because the majority of the samples sent from the Loknayak Jayaprakash Narayan Hospital, which has been at the forefront of fighting COVID-19 pandemic in the national capital region. So majority of samples sent for genome sequencing from that hospital has confirmed that indeed there are some BA 2.75 sub-variant of Omicron found in some recently tested positive samples of COVID-19, and that is leading to latest surge of COVID-19 cases. It has been said that this BA 2.75 Omicron sub-variant is very contagious from the earlier version of Omicron. That led to a surge of COVID-19 diseases in the national capital at the start of this year. However, that wave that started at around January in this year, that did not go out of hand of the policymakers, and things did not take a bad turn as it did during the Delta wave led pandemic wave, second wave during this time around in the last year. So policymakers can take some heart from the data set that was released last night, that number of people who need intensive care treatment, and also the number of beds which are still available as far as oxygen and ICU beds are concerned, that are still large in number, and that those are still abundance in number. So that's why policymakers will not be concerned, because even the policymakers and also experts and epidemiologists across the world are stating that the BA 2.75 subvariant of Omicron, although it is more contagious than the original Omicron variant, but it is not so deadly as previous variant of the disease of the virus as the Delta. So it would not be that point of concern. But this latest surge, surge of COVID-19 could well be due to the uptick in number of cases of BA 2.75, and that's why policymakers had to go back to reintroducing the mask mandate in the national capital region to control the another spread and another episode of epidemic in the national capital region.
All right, Mayank, thank you so much for joining us with all of those details. But let's bring in a little more perspective here. Dr. Sanjeev Bagai is joining me on the broadcast. Dr. Bagai, thank you so much for speaking to us here. The issue that we are seeing in Delhi, a spike in cases, and this is a very high positivity rate that we are seeing. How concerned are you?
Good evening. So I think the message is really not of panic and not of any anxiety, but of extreme caution.
Yes.
We know that during the change of season, and we now know that the change in humidity and the temperatures will gradually decrease in the winter months, the surge generally tends to increase. But peculiarly, what we are seeing now with the Omicron BA 2.75 and now BA 2.76 also has come in, is showing a greater fusigenicity to the human cells. And it is also not using classically the ACE It's using the endocyte route, so it's a backdoor entry. It's hitchhiking and it's hijacking the immune system. It is showing a greater resistance to the vaccine immunity, that means vaccine escape, and to the natural immunity. The so-called hype of the natural immunity or hybrid immunity of vaccine plus past natural infection, especially from the Delta, is not holding good with regards to Omicron, and this is called as immune dumping or immune imprinting. We know that the amino acid changes which have taken place in this particular type of variant, which are classical to have more invasive kind of picture into the patient's respiratory tract. It is not showing as much lethality as the second wave of the Delta, but I think we need to be careful. Coming to the aspects of the mask, I think mask is the most simple, cost-effective, economic, and the most convenient way. One is to stop the human-to-human transmission indoor and outdoor.
Yes.
Any closed, crowded cluster places is best avoided. Wear a mask and you'll be surely very safe.
Yes. Dr. Bagai, once again, what we are seeing here is now, these sort of spikes happening in different parts of the country at different times. A while back, we saw it in Mumbai and some parts of Maharashtra. Now we are seeing it in Delhi. Is this going to be the pattern now that going forward in your perspective?
Yes, indeed. And I've mentioned this many times on many platforms, that these kind of bushfires run at different intensity in different parts of not only of the world, but even in India. This will depend much upon the local immunity, the percentage of the triple vaccinations, the type of precautions people take, and the super spreader events and so on. But the most important thing is to prevent the local transmission of infection, human to human, by wearing a mask. And there is an excess need now of having a booster, which is your third vaccine, as a part of the mandate, because this actually gives you a recall memory. It enhances your antibodies from your germinal cells. It gives you a better trajectory and better breadth and potency of the antibodies to fight COVID, which is BA.2.75. So the third vaccine has become even more important. And the last, what I would like to mention is, if anyone is waiting for a natural infection to come and hit them and develop immunity, they are wrong. Long COVID still exists. There are different studies in different parts of the world showing from 10% to 18% long COVID symptoms lasting of almost up to 1 to 2 years. So it's best to protect and not get infected.
Right. And just on that point, Dr. Bagai, about, people who are trying to get natural immunity, like you said, and there are a lot of those who do feel that if I get COVID, then I'll be safe for at least the foreseeable future. How much time are you protected if you do end up getting COVID? After that, for how long would you be protected then?
Yeah, so there are different groups. So if you have Delta infection in the past, your immunity no longer exists to protect you against Omicron. That's crystal clear. There is no ambiguity in it at all. If you've had a past natural infection of Omicron, which is BA.1, BA.2, or BA.3, it will give you a very transient but a very low immunity against BA.2.75. So this could last just for a couple of weeks. So that is not considering the vaccines. But if you're vaccinated, which is triple vaccinated, and if indeed you had Omicron in the past, it will give you a more durable immunity. But there again, to bank on any aspect of natural immunity to give you a long-lasting herd immunity or community immunity, it will be wrong. Vaccines worldwide have been shown to prevent serious disease and death, percentage-wise, more than 92 to 95%.
All right, Dr. Bagai, thank you so much for joining us and giving us your perspective on this issue.